Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we got Chip in here all the way down here from Austin, Texas, which is, their slogan up there is Keep Austin Weird. Now, I have to say, I've already done Chip's history and examination. He's not all that weird. He's got a lot of common issues that a lot of you have, which is back pain and thoracic spine pain and spasms, muscle spasms and cramps, pain around into his rib cage, neck pain, stiffness, bilateral sacral pain and sacroiliac joint pain, low back pain, stiffness that goes down into his calf. And did I leave anything out?
No, I don't think so.
That's a pretty good guy. He gets adjusted frequently, so he's down here for the very first time getting the ring dinger done because his good friend Milo here is one of our long-term crack addicts fans up in Austin. He's doing everything he can to keep Austin weird too. So we just have to give Austinites a little bit of crap because, you know, Austin people, they said in a GQ article or Texas Months, I can't remember, Austin people just try to be cool while Houston people just are cool.
Yeah, there
so
you go.
Just take it for that. But these guys are cool, I'll tell you that already. So this is Chip's first adjustment, and I've already done his history and exam. Was that thorough, by the way?
Yeah.
Chip?
Oh yeah.
So you've been to other chiropractors before. This is your very first time getting this adjustment,
Yep,
right?
Absolutely.
Would you mind sharing with our crack addicts why you came down here to do this rather than going and seeing your guys up there?
Yeah, I mean, this seems unique to me. I've been to, honestly, about 40 or 50 chiropractors in my life, I put it about. I'm a member of the joint.
Oh, okay.
So,
I'm sorry.
so it's really helpful for me in the past, and it just doesn't stick around. So I saw this, 2 months ago. I just moved to Texas, so I figured I had to come.
Yeah, well, welcome.
Thank you.
So we're going to adjust him first on the BioPhysics table since this is my first time adjusting him. Chip, let's have you lie there on your tummy again. Left leg is short by about a half an inch. You see that?
I did, yeah.
Yep. Watch this. Gets longer by about a half an inch. That tighten up in your low back right there too,
Yep.
Chip? Yep. So that's called a positive Deerfield on the left and a positive Knockless because it tightened up and raised up in his lumbopelvic region and SI joints. Palpatory exam reveals he's got bilateral SI joint subluxations. Lumbar spine, paraspinal muscles are tighter on this right side, and he's got some rotation down here too, where the vertebrae have rotated this way, which that's what I'm feeling when I palpate this, is when the vertebra is twisted this way, which is spinous to his left, the body of the vertebra, the zygapophyseal joints, they make this appear more prominent on this right side. So that's what I'm feeling when I palpate people. So you can tell which way the vertebrae are twisted and rotated by doing that. He's got some dishing in his thoracic spine from the vertebra sinking down inside the rib cage. So he's got some thoracic spine subluxations and rib subluxations. Traps are tight a lot. And he gets the spasms all up and down his thoracic spine, right?
Uh-huh.
Tender on the right there, and right there as well. That's probably where your headaches start when you do have them. Okay, so he had a positive sacral deviation test too, so I'm going to go ahead and start off with his pelvic adjustment first. There we go. I'm adjusting his right SI joint first, then his left sacroiliac joint, and the sacrum straight superior to inferior, pushing it away from L5, both on the left, right, and center of the sacrum. L5 is straight P to A on the Z-axis. These are deep too, Matt. Probably a little deeper than what they looked on YouTube. Yep. There, okay. Yeah, I didn't mean for that to pop up. There, okay. There we go. Mm-hmm. There we go. Okay, it's gonna love you too, Chip. Now, looky there. He's only about 1/8 of an inch short right now, so I'm gonna hit that left SI a little bit more even. Yep. I got it. See the difference? It's exactly even now.
Yeah.
This should tighten up less this time, Chip, but you tell me.
Yep.
Better.
Yeah.
Yep. Stayed even too. See, that went away. Positive Knockless and Deerfield test went away, so that is objective evidence of improvement by adjusting the SI joints and lumbar spine. as chiropractors, we need to continually evaluate the patient's progress when we're treating them. So when you can see pre-adjustment and post-adjustment changes in orthopedic tests and chiropractic exams, that's eventful. Let's turn you on your back. And that's important. What matters most to the patients is getting out of pain, right, Matt? Or right?
Chip?
Chip, I'm sorry. I was calling Matt Chip probably the other day. Put both arms out like this. We got so many new faces coming in here, which is a good thing. I like meeting new people. I love introducing new people to the Johnson technique too. Okay, you can relax your hands right there. So I adjusted his ribs anteriorly in the front here on his sternum, and then posteriorly back in the costovertebral joints. Now we're decompressing his lower end from his knees. There we go. Should have felt those all the way up.
Yep.
Okay, Chip, let's set you up face towards Milo. There we go. And keep that chin up. You're probably used to looking down a lot, huh?
Mm-hmm.
On your phone a lot, or computer.
Yeah.
Texting a lot.
Yeah.
You know, they call that text neck, right?
Mm-hmm.
If you've been going to as many chiropractors as he's told me, that
Yeah.
they're gonna have already told you probably got text neck, huh?
Yeah.
Decreased cervical curve.
Yeah, I have a small phone. My
Reverse.
computer's broken, so
Oh.
I've been on the
Okay.
phone a lot.
There we go. Yep. Good. Milo drives like me. He made it down here in 2.5 hours. There we go. Yeah, there we go. Okay, we're gonna lay you on your back here, Chip, with your butt there, head up this way, please, sir. So I get you a new cut. No, you're fine. You got front row
I just
seat.
put that on there, Dr. J.
Oh, you did?
Yep,
Well, go get
you're
it.
okay.
It's okay, I'll use that one.
No, I'm just talking to Renee. I gotta get her crap every day too. Hey, if we don't give you a hard time, you probably aren't that important to us. So that's what we do. We like having fun with our patients and our family. But all people who come in here and get treatment are important to us. Some are just more fun than others. You're gonna let your legs just relax and bend with the table movement. Now see, he's a little taller, so I pushed 2 on him. So watch it bring his legs up a little taller, higher. Yep. See, he's up a little higher. And where the goal is to always get him parallel. He could probably do with just a tad more even. Yep, right there. Does that feel pretty relaxed with the exception of these pins?
Yeah.
Yep. Okay, you're gonna want to breathe through your nose. Don't bite your tongue. Take a nice deep. There you go. Just like that. Yes, sir. Mm-hmm. We've heard worse.
Oh my God.
Felt that one all the way down. Baby.
Holy God. Oh.
The first one's always memorable. Mm-hmm. There you go. Boy, look at you now. I just slid those in. You're probably going to be sore for about 72 hours.
I
Chip.
believe that.
Yep. That moved all the way down though, didn't it?
Yes, sir.
Yep.
That was everything I thought it was going to
Yep.
be.
Here you go. Sideways. Yep. Alright, she's going to be a little less weird now.
Oh.
Keep breathing for me, Chip. There you go. Deep breath in through your nose, out through your mouth. Will help these relax a little bit more. And we're going to pull these guys here. Flare these guys back like this. And this is your homework right here. Backwards and then look back. You're going to feel a little tap on your atlas there. Another one there. Now relax. Now when you bend your head forward and backwards again this time, this should feel smoother up here, but you tell me.
Yeah, it feels
Take,
smoother.
look where your ears
I
are.
don't even know where I
Back
am
here.
right now. No, it does, yeah. It feels smoother.
Moves everything. So, what would you share with our crack addicts worldwide
I'm gonna
about your
need some
first
time
experience?
to think
About
about that.
your first experience here at our office.
I mean, that was everything that I thought it was going to be. Like, I have never felt that before. I've had a ton of adjustments, and that was like absolutely insane. So,
Well, how did my history and exam compare to what you had previously as well?
Well, I guess recently, the past years, I've just been going in, they trying to just doing it quickly and getting me out. But in the past,
Joint style, huh?
Yeah. I don't think I've ever had someone say those words. You know.
Thorough history.
Yeah. Oh, I'm gonna need a
So
second.
yeah. Well, the first one's very memorable. I put it that way. You never really forget your very first one because we're breaking through fibrotic adhesions and scar tissue that starts developing in and around the spinal joints, the facets, and the nerve roots. So, you know, the first one kind of almost feels like I'm ripping your wheels out from underneath of you.
Yeah.
Because, you know, you feel an initial, I don't want to say this, jolt, I guess you would say. But it's moving everything from his occiput all the way down to his lumbosacral joint. And if you think about it, how old are you now?
I'm 27.
So he's been walking around on 26 years in gravity. So gravity's been compressing his spine all 26 years, and that's the first time you've had that done, right?
Yep.
So if you've been compressed for 26 years walking around in gravity, if you've got a spine and you're walking around in gravity, you're compressed, I promise you. Then your spine and your body just innately lays down fibrotic adhesions and collagen fibers, basically, and it kind of slowly starts gumming up those joints. Over time, when people keep driving their bodies with subluxations and biomechanical improprieties in their spine, it wears and tears the disc in the joints faster. That's called degenerative joint disease or degenerative disc disease. And what this adjustment does is it takes off that compressive y-axis stress on the spine, decompresses it, reseats the facet joints, and they reseat in a better biomechanical configuration. And then we're adjusting all the joints to create a neuroproprioceptive impulse that goes up into the cerebellum, is analyzed by the cerebellum, and then comes back out efferently to the body so that the brain can start remembering this new biomechanical environment that it's in, and that's called neuroplasticity. And that's the main thing that I believe we do as chiropractors is change neuroplasticity through chiropractic adjustments of the biomechanics of the spine and nervous system. So are you feeling any better yet?
Yeah, I'm feeling a lot
calm
better.
down a little bit now?
Yeah.
Feel lighter?
Yep, I feel lighter. I think it's gonna take a second, but I can't believe I've never had that done with all the chiropractors I've been to. So thank you.
Well,
that
you're
was
welcome.
amazing.
Yeah, we're different. We're different. So what would you say to your real Austin friends
Come
about
to
this?
Houston. Come to Houston and
Yeah,
get
there
that
you
done.
go. And then you can be cool. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief with Chip from Austin, Texas. We'll see y'all soon.